Hello, welcome to Medical Dialogues. I'm Roshni. Let's look at today's top medical news. Oral or vaginal misoprostol is a better method than oxytocin for labor induction, states a recent study published in the European Journal of Obstetrics and Gynecology and Reproductive Biology. The updated systematic review and meta-analysis of RCTs revealed that compared with oxytocin, the administration of vaginal misoprostol led to a significant increase in the rate of vaginal delivery and tachysystole risk and a significant reduction in the rate of cesarean. Oral misoprostol was tied to a significant reduction in cesarean rate and a significant rise in the hypertonicity risk, but had no significant effect on vaginal delivery versus oxytocin. For this purpose, the researchers conducted a systematic search of online databases up to April 2023 to identify articles investigating the effect of oxytocin and oral misoprostol on delivery outcomes, including neonatal and maternal outcomes. A total of 45 RCTs comprising 8,406 participants were included. Insulin resistance from high sugar diets tied to increased neurodegeneration risk. A recent study published in PLOS Biology has shown evidence suggesting a higher sugar diet causes insulin resistance in the brain, lowering the brain's ability to remove neuronal debris, thus increasing neurodegeneration risk. Neurodegenerative disease such as ALS, Parkinson's disease, and Alzheimer's disease affect millions of people worldwide. About 15% of people around the world have a neurodegenerative disease. There is still no clarity on the main cause of many neurodegenerative disease, but it is known that certain risk factors play a role. The researchers, using a common fruit fly model, believed a high sugar diet causes insulin resistance in the brain, ability of the brain to remove neuronal debris, thus raising neurodegeneration risk.
Aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code or access the link in the description box below.
In a study on Japanese population with long COVID, prolonged cough and sputum production were closely associated with severe COVID-19. The study has been published in a respiratory research emphasizes on a preventive approach, including appropriate vaccination and contact precaution, and further development of therapeutic drugs for COVID-19 are highly recommended for patients with risk factors for severe infection to avoid persistent respiratory systems. Prolonged symptoms are reported in patients who recover from acute coronavirus disease, defined as long COVID. Cough and sputum are presented by patients with long COVID during the acute and post-acute phases. Researchers in the current study aim to identify specific risk factors for cough and sputum in patients with long COVID. Hospitalized patients with COVID-19 aged 18 years were enrolled in a multi-center cohort study at 26 medical institutes. Researchers found that at 3, 6, and 12-month follow-ups, there were no differences in the incidence rates of wet and dry coughs. In contrast, the proportion of patients presenting sputum without coughing increased over time compared to those with sputum and coughing. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.